This video is dedicated to the men and women who put themselves at risk every day serving others. EMS is fundamentally a transportation-based emergency service, responding to approximately 30 million emergency calls annually and estimated at least as many routine transports. There's been much recent focus nationally, federally, and academically on the issues pertaining to EMS safety, both for the provider and the patient. For decades, EMS has been responding to the majority of calls, regardless of the nature, using lights and sirens, and for the most part, transports these same patients to the hospital again using lights and sirens, again regardless of patient severity. While this seems still to be a common practice, many studies have shown it to be of little value in the patient's outcome. Research has shown that EMS providers die more often than police and fire in transportation-related collisions and are killed at a rate that is more than twice the national average. Even more disturbing is that research has shown that most of these collisions are preventable. The National Highway Traffic Safety Administration estimates there are 10,000 ambulance crashes per year. As a result of these collisions, there is one fatality per week involving EMS responders, their patients, occupants of other vehicles, or innocent bystanders. 25% are those in the ambulance. 75% are pedestrians or occupants of the other car. Additionally, there are 10 serious EMS injuries every day, with 10,000 EMS injuries reported annually. There are many costs associated with collisions, some of which are very apparent. Cost of repairs to vehicles, medical bills, increased insurance premiums, and lawsuits. For every medical malpractice claim, there are 25 claims for automobile liability. 53% of all dollars paid out by EMS insurance companies were due to ambulance-involved collisions. The personal costs of being involved in a collision include being killed or seriously injured, or killing or injuring someone else. An additional cost is the financial hardship of being out of work for an extended period of time. Shorter response times, especially when augmented by the inappropriate use of lights and sirens, carry significant safety risks for EMS providers and the public alike. For this reason, simply going faster is not the solution. More important is the proper triage of calls to determine which ones require rapid lights and siren responses and which ones can be handled in a timely but safer fashion. Many systems have identified that certain minor injuries do not require lights and siren response and may be more appropriately managed by a slower response. The only condition in which rapid EMS response has been shown to consistently improve survival is non-traumatic cardiac arrest. The Emergency Medical Services Outcomes Project identified 7 clinical conditions that account for 65% of all adult EMS transports. Of these conditions, only cardiac arrest, the second least frequent of all of the conditions, appears to require rapid EMS response. Dr. Clausen of the National Academies of Emergency Dispatch states the use of lights and sirens does not routinely save significant time. Studies show time saved to be less than a minute. Time does not matter much in most incidents, and not at all in many. The vast majority of 911 calls are not time-sensitive emergencies, and most are not even emergencies at all. Without question, ambulances should use lights and sirens when dealing with a true emergency, which has been defined as a condition in which there is a high probability of death or serious injury to an individual, and action by an emergency vehicle operator may reduce the seriousness of the situation. Hearing is considered to be a primary warning sense. Reaction time to a visual signal has been shown to improve when an audible warning signal is added. To be effective, a siren signal must compete with the masking noise generated by the road, car radios, ventilation fans, other distractors, and must overcome modern sound insulation. To further illustrate the perception that sirens don't do what they are thought to do, the following experiment was conducted on a closed road in a setting reflecting a typical suburban neighborhood. A standard motor vehicle was parked in a stationary position with the engine idling at a stop sign with the windows up. A digital handheld sound meter was used to obtain a baseline noise level in the car. Video cameras were positioned in various locations with a field of vision wide enough to show the driver. We mounted a camera on the hood of the ambulance, facing forward to illustrate the driver's point of view. Lines were marked on the street starting at the driver's door at intervals out to a distance of 1,500 feet. Spotters were placed along the travel path of the ambulance with tape measures to obtain precise measurements. Starting 1,500 feet directly behind the car, an ambulance drove at 25 miles per hour with the siren set to the whale mode. When the driver of the stationary car heard the siren, she raised her hand, and a passenger in the ambulance dropped a weighted marker. The distance between the vehicles was measured. This process was repeated several times utilizing the T3, yelp, and electronic air horn modes of the siren while adding in distractors, including the radio on high volume, air conditioning running, and the driver of the stationary vehicle talking on a cell phone. Upon evaluation of the data, it was clear that even with today's siren technology, the warning ability of a siren is dramatically reduced by simply having your windows closed, let alone in combination with one or more distractors. Regardless of the siren mode, the vehicle's occupant heard the siren at 1,500 plus feet with the window open. With the windows closed, radio on, and driver talking on the cell phone, the warning distance dropped to less than 283 feet. Depending on siren mode. At just 25 miles per hour, warning time is reduced to 7 seconds, and at 45 miles per hour, warning time is reduced to 4 seconds, neither of which allows for a safe reaction by either driver. This experiment was conducted using best-case scenarios. In real-world situations, you will likely see reduced warning times. When you choose to use your lights and sirens, remember they may not actually save any time, and they will likely increase your risk of being involved in a serious collision. So the decision to use them should not be taken lightly. For a free copy of this PSA and list of references, please visit monarch.org/sirenpsa.